Hi, everybody, and happy Friday. Thank you for joining us for this final week of the 2026 ARC Michigan Disability Policy Webinar Series. My name is Emily Mullins. I'm part of the information and referral staff at Michigan Alliance for Families, a project of the ARC Michigan. A few reminders about the Zoom platform that we will be on today. If you need any tech support during this webinar, feel free to use the chat to message me and I can provide assistance. Attendees are muted for this presentation. If you have questions or comments, we encourage you to type that into the chat. I'll also be sharing links and presenter info in the chat. Um, if you've joined us via the app on your phone, look for the pull-down menu at the top or bottom of your screen to access these features. Automated captions are available for this presentation. Uh, in the chat, I'm going to put a link to the handouts as well as this presentation is being recorded and the recording will live at the same place as the handouts. So when it's available, that's where you can find it. So I would like to introduce and hand this over to Sherry Boyd, Executive Director of the ARC Michigan.
Good morning, everybody. Thank you so much for attending our final week of webinar series on public policy. Today, we're going to focus on the state level policy and legislation activity that's going on, and then the next session will be on federal activities, which I think you all know a lot has unfolded this week. So we look forward to those updates. Before we get started, I would like to say that if we are sharing an action alert that we have out there around DCW wages for the 27 budget, we would appreciate you guys clicking on the link or scanning the link and sending the message to your legislative folks. I'm sorry, excuse me. Emily shared that there's been intense negotiations on the budget this week, so it's really important to fill out the link. Excuse me. So let's get started. Emily Henderson is from McCall Hamilton. She's a lobbyist. She works for the ARC Michigan under contract and provides more consistent activity down at the Capitol Force. We've worked with McCall Hamilton for many years. She knows a lot of things about advocacy, and she's here to share that this morning, plus the updates at the state. Thank you, Emily.
Great. Thanks, Sherry. All right, let me make sure this is sharing correctly. Let me switch my display settings. Sorry, everyone. All right, here we go. Good morning, everyone. It's great to be here today. It's always a pleasure to present to all of our advocates that are joining us Friday morning to learn about what's happening in Lansing. And then I love that we kicked off this session with a call to action for the direct care worker wage, because I will be diving into how to be an effective advocate. And then we'll also be talking about all the steps you can take in order to effectively communicate with your lawmakers. All right, so I'm going to, jump through some highlights, but also give you all some background on the best way to be prepared to have your conversations. And so I'll give you some information on what our current landscape is at the Capitol in Lansing for our state government, and I'll cover all the different big players and big names in the space. So I'll start with our executive branch. And this is subject to turning over here after the election in November. But we currently have a Democratic executive branch that is led by Governor Gretchen Whitmer. And underneath her leadership within our Department of Health and Human Services, we have a number of different bureaus and sections that we work with the ARC. So we have our Behavioral and Physical Health and Aging Services Administration. And then within that administration, we have a number of different smaller bureaus and sections that specialize in different areas. So I've compiled a list of a few of those. Our Department of Health and Human Services is the largest state department in Michigan. And so we have many other areas that we regularly coordinate with. But these are some of the key areas that we are constantly in conversation with department staff and leadership when we are working on regulatory matters or we're working on things at the state capitol. We also, in our other state departments that we have in Michigan, we have our Michigan Department of Education as well as the Department of Lifelong Education, Advancement, and Potential. The acronym for that is MyLEAP. We do a lot of work in our special education space as well. And so these are a few departments where we are familiar with the key players. And then when we cross any issues that have to do in the education space, these are the different bureaus and departments in the executive branch that we also coordinate with. So before I dive into explaining our state legislature, so we have our governor's office. She's the person at the end of the day that's signing or vetoing bills. But before a bill gets to her desk, our lawmakers are the ones that are doing all the work with advocates, constituents, and with their coworkers and staff members to get bills to the desk of the governor. So I wanted to pull up this map for everyone just to give you an idea of how Michigan is similar or different to some other states in the nation. Michigan is a full-time legislature. So our lawmakers are working pretty much year-round aside from a couple, or I guess a handful of holidays and breaks that they set throughout the year. But when you look at this map, you can see that we are one of four state legislatures that actually work year round. A lot of our state legislatures are part-time or a hybrid. So they'll be in for, a couple months sprint, and then they have a long time where they are back in the district and have other jobs. So with a full-time legislature, lawmakers, their full-time job is being a lawmaker. And so we are unique in that case because not every state operates like we do, as you can see by this map. But, so we are constantly doing advocacy year rounds. From January to January, we are consistently meeting with lawmakers and engaging with them and working on developing policy and budget recommendations with elected officials so that they have something to present when we get to that negotiations timeframe. So covering the legislative branch, we have 148 lawmakers in the state of Michigan. And our lawmakers operate on a 2-year session cycle. And then every 2 years, there is some sort of election happening. So this year is an election year. Hopefully all of you have been paying attention to your local elections that will be taking place, as well as the elections that will be taking place for your representative and your senator on the state level. And then we also have our entire executive branch up for election as well. So out of the 148 lawmakers we have in Lansing, we have a split state government. So in the Senate, we have 38 elected senators from 38 different districts in the state. And that is currently led by Senate Majority Leader Winnie Brinks from the Grand Rapids area. We did have a 1918 Democratic majority split in the Senate for the better part of this 2-year session after former Senator Chris McDonald-Ribbett won her election a couple Novembers ago for Congress. And so we had a vacant seat for some time, but recently the Democrats just picked up that seat in May. New Senator Chedrick Green out of the 35th Senate District in the Bay Area, he won that special election. And so the Democrats have returned to their 2-seat majority over on the Senate. On the House side, we have 110 lawmakers. So when you look at the Senate map, we have 38 bigger districts that encompass the whole state. And then that is broken down even further, and that's where we get our 110 House districts. So we currently have a Republican majority in the House. That is a 58 to 52 split. So Republicans have, fairly big lead over in the House, more so than the Democrats had when we had a trifecta 2 years ago. And the House is led by Speaker Matt Hall. Some things to note, and this plays into where we are now in the state legislature and what we expect to see the rest of this year. But with 2026 being an election year, we are currently seeing our lawmakers try to finish a budget before the July 1st self-imposed deadline that they set for themselves so they can spend the summer campaigning ahead of the August primary and then they can prepare for the November general election. As I mentioned earlier, it's a big election year. We have all 148 seats up for election, plus the executive branch. That's the governor, the attorney general, and the secretary of state. So our lawmakers are very eager to get things done before summer starts so they can campaign. Just on the previous slide, so showing you all how close the majorities and minorities are in both the House and the Senate. Our lawmakers need as much time as they can to put forward a good effort in their primaries or their general elections this year. So I wanted to flag these for you just so you can kind of have a sense of what things are coming up and how this plays into an advocacy plan if you do anticipate or hope to call your lawmaker and engage with them because they will be in the district a lot this summer. We have the August 4th primary this August, and then we have the November 3rd general election. And again, all 148 seats plus the executive branch is up for election this year. So big races happening. We also have a gubernatorial race happening, as I mentioned. I did want to note kind of who's leading right now in the polls for all of you, if you're curious. On the Republican side, Congressman John James. He currently sits in office in DC. He just this week was endorsed by President Donald Trump, and so he is kind of being seen as his front runner in the pack. However, we have some other big names in the Republican race, former Attorney General Mike Cox and then businessman Perry Johnson are also definitely putting up a fight for winning the primary in August for the Republicans. On the Democratic side, current Secretary of State Jocelyn Benson is leading for the Dems in the most recent polling that has come out. Another candidate that is in the race is Genesee County Sheriff Chris Swanson. He has recently garnered some more endorsements from state agencies or organizations across the state. So he is also continuing in this fight for that August primary for the Dems. We did have an independent running. Mayor Mike Duggan, Detroit Mayor Mike Duggan, was in the race as an independent, but after recent polling in the past few weeks and months, weren't showing that he was doing as well. I think that he intended. He instead dropped out of the race. So we were going to have an independent on the ticket in November. That is no longer the case. Also, kind of in some notable news this week, current minority leader in the Senate, Eric Nesbitt, he is from the west side of the state. He recently dropped out after John James received the endorsement from President Trump. So lots of things are changing. We expect things to continue to change over the summer, but I wanted to give you all some highlights on what's happening in the election space and how this can impact advocacy and all the things that are currently moving and will continue to move the rest of this year. All right, I am now going to dive in some of our advocacy issues to cover what are we tracking, what are we following, what are we engaged in, and then also covering all the biggest news related to the budget as we approach that July 1st deadline. So some key legislative issues that the ARC has been engaged in and is following and working on in Lansing. And this is not a comprehensive list. I want to make that clear. These are just some of the notable legislation that we continue to discuss in our Government Affairs Committee, that we continue to monitor and meet with lawmakers and talk to them about. But this is not a comprehensive list. I could probably sit here for a couple hours and talk about all the pieces of legislation that the ARC is engaged in and that we are following and monitoring. But we don't have all the time in the world. So I wanted to highlight a couple notable bills for all of you today. Um, just to start, we closely monitor anything that makes changes to the state's mental health code. In this space, especially in recent years, behavioral health has been a big topic in conversation in Lansing with our lawmakers and with our state departments. And so, anytime we see legislation introduced that affect the mental health code, we are taking a dive into that legislation and seeing the positive or negative impact may be um, for individuals in the state, especially our friends and family members who are engaged with the ARC. But aside from kind of broad mental health code bills, we follow lots of different kinds of legislation. So this list is hopefully just giving you all an idea of kind of the different areas that we dive into. So the ARC is regularly engaged in monitoring items around supported decision making. We have personal protection orders for vulnerable adults. There's legislation around making changes to the State Department's Recipient Rights Advisory Committee membership. This legislation originally included the ARC as serving as a member of that advisory committee. When the bill moved out of the House, mention of three different advocacy groups, the ARC, Disability Rights Michigan, and the Mental Health Association in Michigan, were removed from the bill. But we continue to monitor that legislation and push forward for changes to re-implement those three organizations into that legislation. Similarly, kind of in the same bill package is informed consent for mental health treatment. This is legislation to make sure that if someone is receiving treatment, that they, in any form, that they are able to comprehend, that they understand what they are consenting to when it comes to mental health treatment. We also follow guardianship and conservatorship changes in EPIC. So that's the Estates for Protected Individuals Code, different than the Mental Health Code. But we are regularly watching legislation that makes amendments to EPIC in the state. We also get involved in following legislation around voting access and voter ID changes. Most recently, House Bill 4765 passed the House along party lines. This is a Republican-sponsored bill that would make changes to voter ID requirements. So an individual, when voting and registering to vote, would have to have proper identification, which, there are concerns that some of these changes would put a burden on individuals, especially if that individual doesn't have immediate access to their birth certificate or a marriage license if they change their last name, or if they're in a guardianship or conservatorship and their guardian is not willing to provide them with the documentation necessary to be able to register to vote. This bill is something that we're watching closely. A lot of other advocacy organizations are tracking it. And so while this has passed the House, we don't expect the Senate to take it up this year, but it is something that we regularly keep our eyes on, and the impact to individuals with IDD in the state. And then, we're also following some legislation around medically necessary treatment in schools. The ARC, our education committee, was involved in providing our concerns in talking with the stakeholders driving this bill to narrow the focus. When the bill was originally introduced, it opened the door for children in K through 12 schools to be able to receive treatment from any licensed professional in the school district or in the school building. There were concerns that you were opening the door to children not being in their classroom. There are lots of big questions about the intent behind the bill, but we did make really great progress in meeting with stakeholders to talk through those concerns. And then we did see a substitute adopted for this bill that would specify that this is for ABA therapy. And so that the advocacy that we did helped narrow the scope of that bill, so we weren't opening up schools for individuals to get medical treatment in the schools. We helped, have conversations, and we're really happy to see that this was narrowed a little bit more to focus on the intent behind the legislation. So lots of things that we follow regularly year over year. Legislation is constantly being reintroduced if it doesn't make it through the legislative process, or being reinvented every few years. And so some of these bills are things that we've been working on and tracking for a number of years. But some new things like the medically necessary treatment in schools, that is some newer legislation that we are working on and that we are following closely. So I just wanted to give you all an overview of all the different things that the ARC is tracking and involved in the state. So when we are not doing policy, which again, we're a full-time legislature doing policy year round, we're pretty much doing the budget year round as well. I will dive into kind of the budget timeline to give you all an idea of how much time our state spends on crafting a budget year over year. But right now, I'm just going to cover some of the big things in the budget that the ARC follows. First is protecting Medicaid. There will be a presentation after mine that will cover some of the federal updates this week. But we know that some changes that have happened on the federal level are now coming down to the state. And there is a need to ensure that our Medicaid programs, these longstanding programs that have provided services to families and individuals in need of supports and treatment and access at their home and in their community, we want to make sure that we're protecting those things. And so with the budget, we saw the governor earlier in the year introduce her recommendations. And in her budget recommendation, she called for protecting Medicaid by creating new tax streams on different services. And some of those tax streams were taxes on vaping and tobacco products, internet gaming and sports betting, and then online marketing and digital advertising. She proposed about creating generating revenue of over $700 million to backfill lost funds that the state is expected to see related to HR1 impacts. That is that One Big Beautiful Bill Act that passed last year in Congress. And so we are closely monitoring the impacts of budget negotiations this next week, if they do get a budget done by July 1st, and how this will impact access to Medicaid services. We obviously, know that our state is dealing with less money this year because of HR1 impacts, but also because of larger, big picture inflation and economic trends that aren't just in the state of Michigan, but we're seeing nationwide and globally. And so we are continuing to talk to lawmakers about the need to protect our Medicaid, longstanding Medicaid programs, because we all know that if we make cuts in our state budget for Medicaid line items, for Medicaid spending, a lot of the times those individuals, if they're not getting the services that they've been getting for some time, those individuals will end up in the hospital or the ER, which is far more costly than providing the services in the community or keeping services with that individual. So the House and the Senate did not recommend new revenue streams for Medicaid. We learned this week that a budget framework has been set by the governor, the Senate, and the House, and they are negotiating right now on what a budget looks like ahead of that July 1 deadline. And the news came out and they said that they did not agree to implement new revenue streams. And so we are watching closely right now what is going to happen with Medicaid. Will we see services or rates cut in any capacity? We do know that our State Department has been working diligently with the state budget office and with other stakeholders to try to find the least harmful way to continue to protect the Medicaid program, but make sure that our budget is as balanced as possible. I will dive into the direct care worker wage on the next slide, so I'm going to skip that for now, but this is a number one priority for the ARC that we follow year over year and that we are constantly doing advocacy work on really 12 months out of the year. Budget conversations don't really stop. They are constantly moving and continuing. We also follow special education funding. So what does the per pupil head count look like? How are school districts or how is our state recommending to school districts that they use a weighted formula in order to make sure that children that need extra support are getting the money needed for their individual needs in the school district. And then at the same time, we also follow school aid categorical funding. So categorical funding is how districts spend their money, very specific categories that are, there are dozens and dozens of pages of almost like special projects that school districts have to follow in funding different services in the school and for children. And so we're regularly following any changes to those categorical funds and what the impact could be for individuals with IDD. All right. So, on the direct care worker wage, I wanted to dive into this just a little bit more so all of you are aware of all the different things happening that have happened this year in conversations related to our budget. And then so you can be prepared for any action that all of you are wanting to take in advocating for the direct care worker wage this year ahead of the July 1st deadline. So, the governor and the Senate proposed the same recommendations in their budget. So the governor released her recommendations in January, February timeframe. Usually it's February we see that recommendation come out. And then the Senate, after the governor releases the recommendation, the House and the Senate run with that recommendation and make their own budget recommendation. That usually comes out in the spring. So we saw from February with the governor's proposal to, I believe it was May with the Senate proposal, they proposed the same recommendation for the direct care worker wage. So they recommended the continuation of the 340 an hour increase for the direct care worker wage. And then they also added minimum wage adjustments for calendar year 25, 26, and 27. I covered this in last year's presentation, but we have new minimum wage and earned sick time laws in the state. And so that adjustment that was in the governor and the Senate proposal would ensure that for direct care workers, they are getting the 340 an hour increase and they're also getting the minimum wage increase. So that was what was proposed by the governor and the Senate. The House, they continued to fund the wage, but in boilerplate, which is the written instructions for how the state spends money. They removed the specific mention of the 340 an hour increase, and then they included language that said that there would be a requirement to comply with expressly defined network adequacy standards for direct care workers, and it would require reporting on these standards and aggregated rates paid in the provider network and in the public behavioral health network. And then they only included minimum wage adjustments for calendar year 25 and 26. So they did not include the calendar year adjustment that will kick off January 2027. So, what does all this mean? Where do we land on what we're seeing in front of us right now between the House and the Senate? The Direct Care Worker Wage Coalition, in which the ARC is one of the members of and helps lead, we have some concerns. We are very concerned that in general, there is not enough money in our state budget to properly address the new minimum wage and the new Earned Sick Time and Leave Act. We have been engaging with officials on the state level to talk about this issue, so both our lawmakers and State Department officials. And we remain concerned from the coalition, we remain concerned that the money is not there to ensure that all of our direct care workers can get that minimum wage increase and we can maintain that 340 an hour increase, especially when we continue to hear that in the provider network, direct care workers are not getting the money, provider agencies are not getting the money to pass on to their direct care workers. And so in the call to action, which I'll highlight later in the presentation, this is really the message that we wanted to leave you all with today. We have very big concerns about the money that will be in the budget, and that there may not be enough to properly fund the direct care worker wage with these minimum wage increases. All right. So, regulatory issues. So, I just covered a lot of our legislative issues we're working on. So, in the policy space, we have legislation, that's the House bill or the Senate bill number. And then our state budget is also on our legislative advocacy radar. We also work in the regulatory space. So, this is where we are collaborating or writing comments to our state departments in some capacity. And so one of those things that we are regularly on top of and working with individuals within the ARC network, but also other partners in the state, is anything to do with Medicaid waivers. So these are notices issued from the department that talks about coverage and reimbursement for services. We've also seen recent policies come out around work requirements. So, as you all are aware, because of HR1 or the OBBA, we have had major changes to work requirements coming to the state. And so we've already started to see some of those policies get issued out for public comment. We are anticipating some more waivers coming out, or policy notices coming out that we can submit comments to and discuss. But what we saw was that in June, CMS released their guidance for work requirements, which shocked a lot of individuals, not just in the state of Michigan, but nationwide, because those requirements ended up being a little bit more stringent than what the OBBA or HR1 actually had said. So states are now adapting to those new regulations that were released by CMS. So what we can expect to see the rest of this year in this regulatory space is September, our Michigan Department of Health and Human Services will begin outreach to individuals saying, FYI, here are the changes happening if you are insured by Medicaid in the state of Michigan. If you are a beneficiary, these are the things you have to know. And then starting October 1, so that's the start of our fiscal year, on October 1, there will be limits on non-citizen eligibility. So individuals who are asylum seekers, refugees, victims of abuse, who are coming to the United States seeking that asylum or refuge, they will be limited in applying for Medicaid and being insured by state Medicaid. So those notices will go out, that policy will begin October 1st. Then, as we get into the new year, January is when work requirements will kick in. The new work requirements will start in the state of Michigan. So, from September to the new year, it gives beneficiaries in our state some time to hopefully get the messaging out to individuals and make sure that people know what is changing in the state. So, on January 1, for individuals, if you are already insured and you're already a beneficiary, January 1 isn't really the time for you to be concerned quite yet. Work requirements and then the 6-month renewal changes will only apply to new applicants in January. So if you are someone who you anticipate that January 1 rolls around and I'm going to have to enroll in the Medicaid program, what will apply for you is that you'll have to prove that the month prior to applying, that you have worked 80 hours before in order to be eligible for Medicaid. And then you will be on a 6-month renewal plan. So currently we have annual renewals in the state. This is changing. You will now have to renew every 6 months. March 1st, for individuals who are already insured through Medicaid, the work requirements and the 6-month renewal changes will kick off on that March 1st timeline for current beneficiaries. For current beneficiaries, however, you just have to prove that you worked 80 hours within the 6 months prior to that renewal period. So for those that are already insured, there's kind of an easier way to maintain your eligibility in the program. You won't have to jump through those initial hoops as long as you're not a new applicant. But for our new applicants, there are some bigger barriers that individuals will have to overcome in order to become eligible. So we are just receiving some of this information from our State Department as of this week. And so as we get more information, that will be shared with ARC members. So right now, keep an eye out. Make sure that if you are anticipating a renewal or communications from the department, that you are signed up for those communications, that your address is correct, because we anticipate that this will be a big hurdle for many, many individuals in the state, and we know our State Department is going to do the best that they can in order to ensure that individuals are still insured in the program. Some other regulatory issues we're working on, mental health framework. So there is an initial proposal by our State Department that would require Medicaid health plans to cover mental health services for those in the mild to moderate space. This was scheduled to go into effect on October 1st, the start of the fiscal year, but this is temporarily delayed as of right now. There's currently some legislation in the House that is being led by the health plans that would allow health plans to cover those mental health services and conduct that pre-screening for individuals seeking services if the CMH is not able to make it to that pre-screening within a 3-hour requirement. So we're closely watching that legislation, the impact on the mental health framework from the department, but with the department delaying the implementation of this, We are kind of in this space where we're seeing, does the legislation move faster? Does the department reissue any framework policy? All of these things are things that we are watching closely. And then obviously there would be some sort of notice going out to individuals and providers that the ARC would be engaged in. Some big news I'm sure everyone was hoping to get an update on is around our state's public behavioral health system. So, what has been in the news for the better part of a year, over a year, has been the procurement for our state's PIHP system. So, these are prepaid inpatient health plans. We have 10 regions across the state, and they manage their respective networks within the public behavioral health system. So February of last year, and some of this is repeated information from when I presented last June. But in February of 2025, the department had issued a survey to seek input from Medicaid enrollees to identify opportunities for improvement within the PHP system. And this came after we saw a few PHPs refuse to re-sign their contracts with the state after the state issued changes to those contracts. And so the state took a step back and they instead approached the community of beneficiaries and said, we want feedback from you. Following those survey results in May of last year, the department released those results, and then they indicated that an RFP process would begin for the PHPs across the state, and that would happen in the summer of 2025. And then in August, the department did release the competitive procurement for the PHP contracts. That process was long and ongoing and drawn out after some legal battles. After the Public Behavioral Health Network went to had a case in front of Judge Yates in the Court of Claims with the department. And what the Court of Claims found, Judge Yates ruled that the RFP violated Michigan's mental health code because it restricted our community mental health service providers from carrying out their mandated duties set in the mental health code. However, MDHHS could still move forward with reducing the number of PHP regions. So part of that initial proposal was to take the state from 10 to 3 PHP regions. And the judge said the state can change the number of PHPs all they want, but once it impacts the ability for CMHs to do their job that is mandated in state statute, that is where there are going to be issues with any process. So in February, after that ruling, the department withdrew the RFP. And then where we are now, we are expecting an RFP to be released in August. It is currently going through all the necessary steps to be released in that August timeframe and make sure that there are not any legal implications or concerns with that RFP process this time around. So we are closely monitoring the release of that RFP in August. But what we're looking at now is an October 1 start to the fiscal year, August, very close to October 1st. And so we'll be watching closely the conversations happening. If there are concerns from individuals within the ARC or other stakeholder groups, we'll be engaged in those conversations and ensuring that at the end of the day, individuals served by our state's public behavioral health system are not impacted when it comes to any changes to our state's public behavioral health system. All right, I am now going to dive into what is advocacy and why do we engage? And then I'll leave you all with a call to action, and then we'll jump into questions. So, what is advocacy? Advocacy is educating our lawmakers, and building support around a topic or an issue. And advocacy regularly involves nonpartisan research and analysis, sharing your personal stories or best practices with elected officials, or being invited to testify on a piece of legislation. This even includes submitting comments if there is Medicaid policy released by the department on the regulatory side of things. So all of you who are on today, in your own personal capacity, regardless of what your career is, you can be an advocate because you have an elected official that represents your area and their constituents in the district. And educating them, sharing personal stories is the root of what advocacy is. So, as I've covered, advocacy is not just meeting with your elected officials. It includes your regulatory engagement as well. So, it's meeting with your elected representatives and senators, whether it's one of the 110 or one of the 38 elected officials in our state. And then again, it also includes our Department of Health and Human Services. Our Department of Licensing and Regulatory Affairs is another organization that we're monitoring what news or changes may come out of that department. But advocacy is not just your elected officials. There are many other areas in which we can do advocacy in the state. So why should you engage with your lawmaker? Lawmakers are not experts in all of the things that you may care about. And with the ARC, they are not experts or well versed in the mental health or the IDD space, or someone who's living with IDD or has personal experience in our state's public behavioral health system or as a beneficiary. So you likely know more than they do, and our lawmakers rely on constituents and advocates to share with them their stories in order to impact legislation and ensure that that elected official is making critical decisions and they're voting properly with the education that they receive from individuals who connect with them. So, as an individual, whether you have lived experience in this space, or you have a family member or a friend, or your organization allows you to connect with your lawmaker, and in your organization, the work that you do, you are involved in this space at all, you are an advocate every day in that role. And so your perspective is unique and critical, and then you have the ability to develop a relationship with that lawmaker in your personal capacity as a constituent, as a voter. You can develop that relationship and create a friendship, or create being an acquaintance with that lawmaker, so that when they do have an issue that comes across their desk, they know who to call and who to talk to about it. So I'm going to walk through a couple steps here really quickly on how to be active in advocacy with your state lawmakers. First, know the landscape. I've covered a lot of these things already, but know who's a majority in either chamber. Know who the Senate Majority Leader is, the Minority Leader is, or the Speaker of the House, or the Minority Leader in the House. And also be aware of how many terms this lawmaker has been elected in the state of Michigan. So we have new term limits in the state. It's 12-year total. So you can serve 2 years in the House, then finish out your 12 years in the Senate. And so, you always want to keep track of how long that person has been in Lansing. Are they familiar with the issue that you're talking about? Were they here 6 years ago when this piece of legislation was brought up in front of a committee? Did they vote on it? You want to make sure that you're very familiar with with the landscape in Lansing and with your elected official. You should also be very familiar with the state budget process. So right now, while we have lots of bills that we are tracking, our lawmakers aren't necessarily focused on those policy initiatives because we are facing a tight timeline in that July 1st deadline for a budget to get to the desk of the governor. So right now, our lawmakers, I've already mentioned this, are negotiating that fiscal year 27 budget so they can meet that July 1st deadline, especially for our school aid budget. Schools, start planning for the fall and the summer. But as you can see from this chart, we don't really ever stop doing the budget. But if you are familiar with this budget cycle, you can make an informed decision on when is the best time to call my lawmaker. So right now, as they're negotiating the budget, our lawmakers need to hear about the direct care worker wage issue. While you may really care about legislation to expand personal protection orders for vulnerable adults, our lawmakers are not going to be focused on that bill right now because they have a deadline that they're trying to meet. And so hopefully this budget cycle image can help give you an idea of not only how our state budget works, but when is the best time to connect with your lawmaker. And in the budget space, really February to now, February to July 1st, maybe into the summer if they don't have a budget done. But this early part of the year to now is the best time to talk about the budget with your lawmaker. It's also really busy policy time. And so typically when we're not at the end of June, it's a great time to connect with your lawmaker on policy, but know that this summer they will be in district campaigning and in their community more so than they have been the past few months. And that is a really great time to engage them on policy issues. But right now is the height of budget negotiations, and it's a time for our lawmakers to hear from their constituents. So once you familiarize yourself with the landscape, how do you connect with your lawmaker? I do have a QR code here that you all can scan. Again, this presentation will be online, so you'll be able to find it if you aren't able to get your phone out and get this QR code. You can also go to Michigan Votes. It's a really great way to engage, almost with an interactive map to find your lawmaker. You can find your state representative and senator here. Again, this is for your state elected representative and senator. This is not for your congressional member. So do make sure that when you are looking for that elected official, you are identifying your Michigan state lawmaker, not your Michigan lawmaker in Congress. But making contact with your lawmaker, you can meet with them in district or in Lansing. We are approaching again that July 1st deadline. So if a budget is done by July 1st or before that July 1st holiday, our lawmakers won't be here that much ahead of the election season. So our lawmakers will be in district. So Lansing's probably not the best time this time of year to meet with your lawmaker, but they will be hosting events all throughout the summer. And so you can follow them on social media. You can sign up for their newsletters on their websites, and you can find time to engage with them in the community. But you can also reach out to them and say, hey, we are hosting an office hour, or we are hosting a site visit. We'd love for you to come join us. We will be engaged, the ARC will be engaged in some community outreach events this summer with all of our elected officials from the local level up to the state and up to Congress in talking about the importance of the direct care worker network and the wage issue. And so, we will be laying the groundwork this summer for those elected officials and with community organizations in order to elevate the ARC's priorities. When you make contact, I wanted to give all of you the opportunity to have a little bit of a starting point when reaching out. So you always want to introduce yourself. Are you a constituent? Do you work in the district? Do you have a family member or a friend that lives in the district? That'll be really important when engaging with your lawmaker. They will want to know if you are a potential voter or if you have roots in their community somehow. You always want to also let them know why you're contacting them. I'm here to talk about House Bill X or Senate Bill X. I'm here to talk about the direct care worker wage issue. All of those things, just a high level, quick mention of what you want to talk about is also very important in setting up a meeting or calling an office. You also want to give them your contact information. A lot of times, our lawmakers are dealing with very, very busy schedules, especially in election year. And so, giving your contact information so they can follow up with you will be necessary, as well as sharing your schedule. If you know that you can only meet on Tuesdays, make sure that the office knows that. That will give them some sort of sense of scheduling when trying to find a time that works for the representative and their staff and you. Make sure you are doing self-education and prepping for your meeting. Know who your lawmaker is. Google a picture of them. Be familiar with their face. But you also want to check out their social media, their website. See what they're talking about. Are they talking about big things happening in Lansing that maybe don't have to do with the policy area, the budget item you want to talk about? Are they really focused on one of the issues we do care about? Are they a bill sponsor for legislation that you want to speak with them about? All of those things are really important when prepping for your meeting. So you go in and have some understanding of what they're working on, what they're engaged on. That will help you know, do I have to start from like the base level? We have to talk about what Medicaid actually is. Then we can talk about some of these concerns we have about the direct care worker wage. That can help give you a sense just from their website and their social media on how, like back to the basics, you may have to go in your conversation. On the flip side, if the lawmaker is posting about the direct care worker wage, they may already be an advocate, but you can still elevate, the importance of the issue to them. And you don't have to like break down the basics of how individuals get paid and how does the money flow through the state and down through the provider network. You'll also want to pay attention to the district, what cities are in the district, what's being reported locally, and then finally the current state of politics. Advocacy updates through the ARC. You are always welcome to see those updates that our team works on at McCall Hamilton. We try to give high-level overviews of big picture things in Lansing, and then we break down any notable things of interest for the ARC in that report. But also check out your local politics section with your local news. That is a really great way to see what the lawmaker may be talking about or things that they may care about outside of what's happening in Lansing. Being prepared, make sure you're meeting at the right time. Again, now, this week and next week, not the best time to try to talk to your lawmaker about some policy stuff, but this summer, definitely a great time to meet with them. Be confident in your personal story and your expertise and know your story. If you bring any written materials or handouts for your lawmaker, it's a great way to have them leave with something so they can be reminded of the conversation. And then don't be afraid to practice and then bring something with you to take notes. If you are invited to testify or you want to testify or be on the record when bills are moving in support or opposition, you have the opportunity to do that. You would need to be in Lansing for it, but oftentimes you can also email committee clerks and let them know your position. But I wanted to provide you all with what this looks like. You'd fill out this card in the committee meeting, and you would turn that in to the clerk at the front of the committee room, whether that's in the House or Senate building or the Capitol. And then if you are speaking, you check that box, yes, I want to speak. You usually have to kind of keep things wrapped up to 5 minutes or less just based on the agenda for that day. But I also wanted to leave everyone with providing verbal or written testimony to the committee, what that looks like. I do have some images of what these committee rooms visually look like if you do want to take a chance to come to Lansing and speak on an issue. But I won't go through this whole outline, but this kind of breaks down what is needed in your written or your verbal comments in order to have a comprehensive testimony in sharing your personal story with elected officials. Just a couple tips too, just for the occasion. If you're verbally testifying, bring written copies of your letter if possible. It will be online for the minutes, so anyone can go back and look and see what comments were made. Oftentimes, you'll be asked questions after you provide comments verbally. And I always like to let people know that I don't know, and I can follow up with you is a really great answer. It's always a suitable answer to a question. Do not ever feel pressure to be put on the spot in answering something if you don't know the answer, aren't prepared to answer that question. It's also a really great way to stay in touch with that lawmaker when you say, I'd love to follow up with you about it. Let's talk about it offline. And then step four, highlighting some of the things that I've already discussed is, how to stay engaged. So again, make sure you're identifying your state lawmaker, connect with them in district or in Lansing, and then be sure to use key resources, Facebook, state web pages, signing up for newsletters. All of these different things are a great way to understand what's happening with your elected official in Lansing and then in the community. And so really the call to action here for all of you would be scan the QR code, find out who your lawmaker is, and call their office or send them an email and say that you want to elevate the concern that we may not have enough money. We don't know if we have enough money in the budget for the direct care worker wage, or we are concerned that, XYZ, whatever issue you may care about in the budget, especially as it relates to Medicaid, all of these things can be communicated to offices at this point in time. So that would be my call to action to all of you today. And at this point, I've been seeing the chat light up with the red number rapidly increasing. So I am happy to answer any questions at this time.
Hi, Emily. Let's start with a question about working with your legislators. How do you get them to prioritize an issue that isn't part of their platform?
That is a great question. Lawmakers get elected and come to Lansing because they typically have something they really care about or an agenda that they want to push in Lansing. And so lawmakers learn to care about new items because they hear from their constituents. They hear from people served by the state in some capacity. They learn about the issues that are occurring in Medicaid because constituents call and want to discuss these issues. Every once in a while, you may get a lawmaker who just doesn't care about it. And to that point, I would say, sometimes you can't convince everyone to care about make an issue their number one priority. And so you can continue that outreach outside of your district with your elected official. My recommendation would be find someone in close proximity to engage with them. But really, it's that continued outreach. It's going to those coffee hours and telling your personal story. That is what builds the grassroots momentum and gets those lawmakers to care about an issue. And then bringing your friends and family with you, finding other individuals to be engaged on the topic is a really great way to get that lawmaker to realize, like, wow, this is a big issue that I should really care about for my constituency.
All right. Thank you for that response. Going back to the very beginning of your presentation, you talked about allowing ABA therapy in school. We have a question. Has the autistic community's concerns with ABA been considered with the specifically allowing and only mentioning ABA therapy?
Yeah, so my understanding is the original intent of the bill was to focus on that ABA therapy lens. And so the substitute that was added to that legislation was to specifically clarify the original intent of the bill. And so there were organizations in the autism community that were working on that amendment and working on those changes. And so my understanding is that a lot of the concerns have been assuaged by this new amendment that has been added to specifically focus on ABA therapy.
All right. Back in that beginning section, you also said that there had been changes to the Recipients' Rights Advisory Committee. Do you have any insight onto why those advocacy agencies were removed?
Yes, our understanding is it was one of those kind of purely political moves that happened. The lead bill sponsor, Representative Jamie Thompson, and then for the similar bills over in the Senate, Senator Michael Weber, those two individuals have been very vocal about wanting to make changes to this section of statute in order to allow some more transparency and get some other groups engaged in that coalition. It wasn't necessarily a favorable choice by the bill sponsor, Representative Thompson, to make this change to the bill. She was pushed to remove those advocacy organizations because other members in the caucus, some loud members of the Republican caucus, um, I think they have their own personal issues with state departments in general. And they also didn't love the mention of of having organizations in the bill because maybe they thought that those organizations didn't align with their political agenda the same way. So again, it was unfortunately purely political, but we continue to push and hope for the inclusion of those three organizations in that bill should the Senate consider it this year. We kind of have a big question of what's going to happen after August and November if our lawmakers will come back to Lansing and continue to work. Um, and so we hope that we can get those organizations back in that legislation. But it was unfortunately one of those purely political. A couple loud people had concerns. And so, in order to get the Republican members to vote in favor of the bill on the floor, it came with removing the organizations from the bill.
Okay, thank you for sharing that insight. We next have several questions about Medicaid work requirements and budgets. So, to start off, thinking about the Medicaid work requirements, does this apply to all people currently on Medicaid? What about people who have been deemed unemployable by an agency like MRS?
Yes, I'm sure we can share the information on the Medicaid work requirements to dive into some of those details because I don't have all of them right in front of me. But we have heard from the department that individuals who have been beneficiaries for some time, and it is all Medicaid beneficiaries, the department still has a system that allows them to keep track of those individuals, and so that's why we have individuals who are already served by the program. They will not have to do that renewal in January. It will instead go to March. But they do have, a list internally within their system that allows those who have been deemed unemployable and that still fall under the exclusions in the new policy issued from CMS. They will continue to stay on Medicaid, and I believe the re-enrollment will be easier. But again, we are still waiting for that final policy from the department. So just speaking to it high level at this point in time. But Sherry, if you had any details, maybe that I haven't shared yet, feel free to jump in.
I mean, I think it's too soon to tell, but I did share the YouTube video from the department this week and the website where the latest information is and what they're doing and how the policy proceeds. They're they they're waiting, for the final guidance on the medical frailty piece, and so we'll keep y'all up to date as much as we know. They've been very helpful this week in terms of sharing lots of information. So
Thanks, Sherry. Yes, very new. I don't think we anticipated that what CMS released would be more stringent than what was passed in HR 1. So not only Michigan, but many other states are grappling with these changes at this time and trying to adapt appropriately.
I'm putting in the chat now a link to the ARC Michigan newsletter so you can get regular updates on all of this information. Um, a quick clarifying question. You said these Medicaid work requirements apply to everybody. It was somebody else's understanding that applies to Healthy Michigan 19 to 65. Is that included in everybody or is that separate?
I believe that, Sherry, I'm going to kick it over to you if you have that in front of you.
the Healthy Michigan Plan folks are um the population that this is supposed to apply to. It doesn't apply to SSI beneficiaries necessarily. Because Michigan is an expansion state, it's the Healthy Michigan Plan folks.
All right, so the question, SSI beneficiaries, this does not, the new Medicaid renewal and work requirements
Doesn't
do or
apply to
do
them.
not apply to SSI.
Does not.
All right, thank you. We
Thanks,
had
Sherry.
that question come through several times, so I appreciate you answering it for me twice. Um, let's talk budget. With all of these changes, uh, is there any budget? Does the budget include any additional staff to process these new eligibility barriers and requirements?
Yes, thank you for that question. In the governor's proposal, when the state budget office presented on the budget, they did include additional money that would need to go to the department in order to process eligibility for Medicaid and also the changes to SNAP requirements that are happening on the state level. We don't have a budget finalized yet. Our lawmakers have just started finalizing the framework and some of the big picture things Wednesday or started working on them. So we don't have all the final numbers on what it's actually going to cost and how much money will have to be moved around in order to pay for those new full-time employees. But we have heard many times from the state budget office, from our department, that they will need to find new individuals or have individuals work more hours in order to do all this processing from all the things that have stemmed from HR 1 and those changes. Um, we have heard the past year, not just now, but even last year, our House Republicans are focused on, cutting the waste, fraud, and abuse that they find in the budget. And so that comes with unfilled full-time employee positions. That's what FTEs are in our state budget. And so I anticipate that at the negotiations table, there'll be a lot of conversation about how many employees are needed based on individuals that already work at the department, and then how many more spaces they may need to fill and what that costs. So again, we don't have the final numbers because we anticipate that those negotiations will be pretty detailed, potentially contentious, just based on the conversations happening in Lansing. But yes, there will need to be more employees and staff members within the department in order to process these claims.
All right, thank you for that question and answer. Um, so thinking back to the slide where you were talking about the $3.40 increase being mentioned or not mentioned, um, this question is about they have a per unit rate set for CLS and respite. Will these go down if the funding is not approved to cover all services?
Sherry, do you want me to kick it over to you for that one?
I mean, in theory, I see a lot of questions in the chat about rates. Um, we we are working very closely with the department on this issue because as a result of not having money, people across the regions, I shouldn't say people, CMHs and PHPs have made the decision to reduce some rates or to say, we already pay you a rate that covers these increases, and then we see providers that are not making ends meet. So that really speaks to like having enough people to do the work. I saw specifically the Detroit D-Wins issue, and just know that we've talked to the department about it several times. Congressional folks from Detroit have sent a letter to D-Win about the issue and that why are you doing this? You have extra money in your budget. Are reporting positive. So why are you making a cut? And probably it's anticipation of what they think the budget's going to do or not do for 27. But all that to say, it's just really important to reach out to your legislative folks and let them know this is going on. I would encourage you to reach out to the governor. I mean, anybody that you can get to listen because we're seeing it across Michigan, and the department continues to say that they need providers or people who are providing self-directed supports to send them the numbers so that they can try to make a determination whether the CMH is following the rules or not. They have not been very helpful with this issue because they see it as a PIHP enforcement issue. So that's what I got. You can check out our,
That's a full question for Emily. But for Sherry, say what DWIN stands for.
it's the Detroit Wayne Integrated Health Network. It's the Wayne County CMH.
Thank
And
you.
the
So a letter was sent out earlier in May about a rate reduction, um, saying that effectively July 1st, all of these amounts are being reduced. Um, what feedback or comments might you have beyond what Sherry shared?
If, for individuals wanting to be involved in the advocacy in their public behavioral health network, I think it'd be engaging with those officials in the community to let them know concerns as a person served, a family member. If are in the vicinity and work in that network, those concerns should be raised to those individuals in that community. We do know that lawmakers in the DWIN area have been contacted about this issue. And so that has reached Lansing, and there are major concerns. We've heard them in committee. These lawmakers have been continually speaking about what they hear, not just coming out of the Wayne County area, but across the state from individuals who have issues in the behavioral health public behavioral health network. And so aside from making sure that your local CMHs or PIHPs know of concerns and the impact, it's contacting those lawmakers because those lawmakers do take action. We've especially seen this legislative session that our lawmakers want to help find solutions to these real concerns and real issues that are happening on the ground across the state in the behavioral health space.
All right, thank you so much. Just to finish sharing the information that was provided in the chat, the current rate under Children's Waiver Program, which is a program that allows children with significant disabilities or complex medical needs to stay in their home rather than requiring to be placed in some other setting. And the information shared with me is that the current rate is 33.68. And the concern is that the reimbursement reduction to 25.88 is going to create a barrier to having a workforce that's available to take care of these youth.
Yeah, this is again with our Direct Care Worker Wage Coalition as well, a common conversation. How can we ensure we have the workforce to provide the services that we need for individuals when someone can go get a job working at a fast food restaurant and then get paid the same or more and then get all these other benefits on top of it. So again, regular advocacy, especially if you've already contacted your local entities and you're not getting a response, local advocacy with your elected officials is a really great way to continue to raise these concerns and issues with them.
Another question about budget. The department has said that they can't mandate that the pass-through of funds due to the way that the legislation was written. Um, are we advocating to fix or change that language in upcoming budgets?
Yes, the Direct Care Worker Network, Wage Network, is regularly working with our elected officials to find a way to make changes to boilerplate. So again, boilerplate are the instructions in how our state spends money. The past few years, we've continued to try to find solutions with the boilerplate in order to ensure the pass through of funds. We're at this time right now where our lawmakers are having those closed door meetings amongst each other and with department staff. And so we have members within our DCW network that continue to elevate notices and letters and recommendations for change for the boilerplate. So, yes, that is something that we continue to work on and that we hope to see change. But we don't have any active legislation at this point in time because the direct care worker wage issue that is largely in our budget and our boilerplate. So, again, continuing to track that conversation and see what changes may be presented for this upcoming budget.
Well, looking at the chat, I think we've come to the end of our questions that we have for you. Our next presenter has also shared a link to the ArcUS resources that are now available to answer some of this Medicaid work requirement questions. So thank you so much, Emily, for being here and joining us today. Actually, thank you everyone for being here. We'll just take a very short break and then we will get started at 10:45 with our next session. Thank you.
Good morning, everyone. It's Sherry Boyd again, and we're going to continue on with our second session for the morning. I want to welcome Kim Musheno from the Arc of the United States, who is nationally recognized as an expert on federal disability policy, and she's going to provide updates on Medicaid, SNAP, and education, along with other things that have developed this week. Lots of things going on at the federal level, so we're really excited to have you here. Thanks a lot, Kim.
Thank you for having me. So as Sherry said, I'm going to go over a little bit of what's going on in Washington. So first, I'm going to go over a little bit of the current landscape. Next, the political landscape, that is, which is important to understand the political landscape because it impacts, what how we approach federal legislative advocacy. Republicans, as you know, hold a majority in the presidency, House, and Senate. We call that a trifecta, but it's a very narrow and very narrow majority, very slim, and we're living in a very divided and partisan time. So that makes it very difficult for the majority to get anything done unless they have bipartisan support, which is really important. So anything that we are doing, we try to make sure that we have bipartisan support for our priorities. The agenda of the majority includes major tax cuts, which were enacted last year, deporting immigrants, and dramatically reducing the overall size of the federal government. And you saw this in the beginning of last year with the DOGE cuts to federal agencies. They're also trying to withhold grants in a dramatic way. They're trying to, there's a proposed rule out right now um, to give the executive branch more power over what grants to release. Congress has always had the power of the purse. In other words, the power over appropriations, but they have ceded a lot of power to the executive branch, and this is impacting some of the programs that we care about. And then, of course, it's an election year, and that has a big impact on how Congress behaves. They care about whether they're reelected, for example. And so this is a midterm election year. That is, the president is not on the ballot, but many members of Congress are, and other local and state officials. Next. So let me just talk really quickly a little bit about the federal funding picture. The president proposed his overall budget, or the administration's overall budget, in I guess it was early March. It's usually in February, but it was a little late, and it was in March. And as it did last year, the president, along with their agenda, makes some major cuts and structural changes to a lot of programs, including disability programs. We strongly oppose these cuts and structural changes. And last year, when that happened and advocates came out strongly against them, the Congress pushed back on it, and we believe the Congress will push back on it again this year. Some of those structural changes are consolidating the developmental disabilities programs, such as University Centers for Excellence, the DD Councils, and the Protection Advocacy. And when programs are consolidated into one pot of money, it usually results in major cuts. So we have been very concerned about that, about losing, for example, our University Centers for Excellence in Developmental Disabilities. So our coalition has been working together to make sure that Congress is aware of how important these programs are. And Congress is pushing back on many of those cuts. However, as the appropriations bills are making their way through Congress, there are, they're level funded, which really amounts to a cut if you take into consideration cost of living increases and inflation. Um, so um, so it's really a cut when we have level funding. In any case, as I mentioned in the first slide, Congress has a hard time getting anything through Congress because of the extreme partisanship, and because it's an election year. So we, while Congress is marking up some annual appropriations bill, we don't think that they will complete work on the one that's most important to us, and that's the Labor, Health and Human Services and Education Funding Bill. We're pretty sure that we'll have a continuing resolution in September, and then they'll push these funding decisions until after the elections. But meanwhile, it's still important as you're talking to your members of Congress, to make sure that they are aware of how important these DD programs are, like the Developmental Disabilities Councils, the Independent Living Centers, University Centers for Excellence in Developmental Disabilities, and our Disability Rights Centers. Next. Okay, so a little bit, well, actually, I'm going to focus on Medicaid mostly, but I'll give you a little overview of what's going on in both Medicaid and SNAP. Next. So first of all, I know that you all know how important Medicaid is. It's a joint federal and state program that provides health insurance and long-term services and supports. It supports early intervention, education programs, physical therapies and other therapies, and then also aging programs. And because it's a federal state program, the federal government pays about 67% of Michigan's Medicaid funds, and then Michigan has to make up the rest of that. So it's a shared program, and every state has a lot of options on how they want to formulate and create their Medicaid programs. So Michigan receives about 18 billion in Medicaid funds from the federal government. But because of last year's reconciliation bill, the also known as the One Big Beautiful Bill Act, Michigan could see a 17% cut over 10 years. And this is a major cost shift to states, which I'll talk a little bit more about. And as you know, Michigan already limits the amount of home and community-based waivers due to constraints on the state budget. Home and community-based services is an optional program, so whenever there's a tight budget, that's the first to be cut. And there's already a waiting list in Michigan, so we're concerned about that getting worse. And when you get these handouts, you can go to the link of Michigan's one pager that we put together, and you're welcome to use that when you're talking to your members of Congress. Next. So I'm going to talk a little bit about last year's reconciliation law, sometimes called the One Big Beautiful Bill Act, or many people call it the One Big Ugly Bill. Republican members of Congress know that it's not popular, and so they changed the name to the Working Families Tax Cut Law, which I find really interesting. But the budget reconciliation law was signed last July 4th, and for our programs, it makes historic cuts to food assistance or SNAP and Medicaid. In fact, it cuts almost $1 trillion to the Medicaid program. And now Congress is, or at least the House of Representatives, is trying to push a third reconciliation law. And we are sending a letter up to Congress right now, today, saying, no, please do not do another reconciliation law. And if you do, please don't make any further cuts to Medicaid, because we're already concerned about the cuts in the first reconciliation bill. The second reconciliation law that was passed was just dedicated to funding immigration programs. Next. So regarding SNAP, or the Supplemental Nutrition Assistance Program, which helps more than 42 million Americans put food on the table, the One Big Beautiful Bill Act, or the reconciliation law, made historic cuts to the program, a 20% or 186 billion through the next decade. What we're concerned about is this cost shift to states means that some states just might not even, they might just end the program because they can't afford to provide the administrative burden. Next. The reconciliation law, as I said, has an historic cut of almost $1 trillion over 10 years. And the nonpartisan Congressional Budget Office says that 10 million could lose coverage. And a big part of that are the work requirements. And I know you were some of you were talking about that with the previous the previous person that was presenting. And the budget office says that 270,000 could lose coverage, Medicaid coverage, due to the work requirements. And I'll talk a little bit more about what that means. But the big thing to know is that the One Big Beautiful Bill Act really represents a huge cost shift to states. And Michigan could receive a cut of 32 billion in Medicaid, or 17%. And so while members of Congress kept saying that this has nothing to do with disability services, anytime that there's a big cut to from the federal government to the states, states have to make up for that funding shortfall. So there's a lot of concern about rural hospitals, and I know that Michigan is very concerned about rural hospitals surviving because they get a large part of Medicaid funding. And so these hospitals really depend on that. One of the provisions in the One Big Beautiful Bill Act makes it harder for states to raise revenues to make their part of the match. There's just a lot of misunderstandings about some of the what they call provider taxes. And this is a very legal way for states to raise their part of the Medicaid funding. But the reconciliation law now will reduce the amount that states can raise using provider taxes. So I'll go more into how some of these so-called savings of $1 trillion are achieved. Next slide. So a lot of the so-called savings in the One Big Beautiful Bill Act come from targeting the Medicaid expansion. The Affordable Care Act, passed in 2010, allowed states to expand their Medicaid program because there were about over 20 million people nationwide were going without health insurance because of low incomes. So the budget law allowed states to expand their Medicaid to cover more adults that don't necessarily have disabilities. And the but many members of Congress were angry about that. They did not want to expand Medicaid. And so ever since 2010, they've been trying to repeal the Affordable Care Act, or at least try to weaken parts of it. And one part of it is this expansion population in Michigan called the Healthy Michigan Plan. So for those states that expanded Medicaid to cover more people in their states, this new law, this new reconciliation law, adds work requirements. In order for people to keep their Medicaid, they have to those that are getting Medicaid in the expansion population, not SSI, but those in the expansion population will have to prove that they are working or going to school or volunteering, or a combination of those three. It also requires of the expansion population more frequent eligibility checks, at least every 6 months instead of every year. It adds additional co-pays for certain enrollees. And as I mentioned before, it reduces the flexibility to raise money to meet the state match. So, and finally, it eliminates the funding incentive in place for the 10 states that haven't already expanded Medicaid, because states that expanded Medicaid get a higher matching rate, 90% instead of the 76. Next. So as I mentioned before, while the reconciliation law doesn't directly target people with intellectual and developmental disabilities, we know that cuts to Medicaid in one area will affect all others as a cascading effect. And people with intellectual and developmental disabilities are found in all parts of the Medicaid program, including the adult expansion population that's being targeted. And we have seen in the past that when the federal government makes cuts to the Medicaid program, history shows that that states will choose to cut optional programs, and unfortunately, home and community-based services are optional. Institutional or nursing home care is mandatory, but HCBS is optional. Next. So here's the implementation timeline for the OB3, or One Big Beautiful Bill Act. Nothing changes today. Most of the changes go into effect after 2027. But as you know, Michigan is already preparing for changes that resulted from HR 1 or OBA. And the work requirements will go into effect in January. The interim final rule just came out on June 1st. And we're very concerned about the interim final rule. I did put a summary in the chat, and I can do it again when I'm finished speaking, in case you missed it. But it just came out on June 1, and so we have been analyzing this interim final rule. And we're concerned that it's more restrictive than the law itself. And one of the things that we're concerned about is that the definition of medical frailty, which is one of the ways that people can be exempted from the work requirements, is narrower than the law itself, and it conditions the exemption on inability to work or inability to meet the community engagement requirements. And we have always been concerned about linking inability to work with any kind of benefits, because of course people with disabilities want to work. Most people can work and want to work if they get the right supports, but they need their health insurance to get to work. So these work requirements are not do not help people get work. They just take away health care and cause paperwork burdens. Next. So what should you do to prepare for these changes? Well, first of all, you need to help people understand their path to Medicaid and SNAP or food assistance. Because not everybody understands how they're getting their Medicaid, and whether or not they're in the expansion population. So understanding the new work requirements in Medicaid and SNAP are important so that we can help individuals and families comply. And then individuals and families should pay attention to any announcements they're getting from the Centers for Medicare and Medicaid and state Medicaid offices, in case you're getting a notice about a redetermination or having to comply with these work requirements. You should be advocating with your state legislature and governors to protect disability funding. As I mentioned, it's going to be tough going for these states to deal with these cuts. So in some states, we've already seen cuts to disability services, but when individuals and families speak out and testify at hearings related to these budget cuts, sometimes they're reversed and protected. So it's really important for you to pay attention to what's going on to your state budgets. It really is helpful if you have a state coalition and you're participating so that you can be more powerful and share resources. And I know you have an alliance, and I think that's great and really important. And it's important to share and share your impact stories. When you're seeing any of HR1 impacting people with disabilities, please share those with us and with your legislators so that they can understand and maybe make changes in the future. And then you can comment on the interim final rule on the work requirements that just came out. They're due on July 31st. And the ARC will be providing a really simple portal for folks to go online. We'll share a link. There'll be suggested text, and you can change the text. But it's going to be really important for there to be a lot of comments on the work requirements so that they can see that our concerns. So we'll be helping our state chapters. We'll do a template. The ARC will be providing comments, and then we'll be providing templates to our state chapters, and then we'll be providing a portal to make it easy for individuals and families. Next. So besides HR1, we thought HR1 was our biggest threat. And it is a threat to Medicaid funding. And we thought that was going to be the only thing that we had to deal with was, budget cuts at the state level. But that is not true. Instead, we have new threats to Medicaid from the administrative side, not the legislative side. So what's happening is CMS and the White House are claiming that Medicaid is rife with fraud, waste, and abuse. But these claims are being used to make cuts, and they're just saying without evidence that there's widespread fraud. We know that there is fraud in any healthcare system, especially a big one like Medicaid. And of course, bad actors, we should get rid of the bad actors and try to make sure that all of the administrative parts of Medicaid are working properly. But it should not be used for these broad blanketed withholding of Medicaid funds, which is what's happening right now. For example, in Minnesota, they withheld $350 million of Medicaid funds until and unless Minnesota proves that there's no funds in their Medicaid program. That is not historically how Medicaid fraud has been rooted out. Normally, the Medicaid fraud units in every state are monitoring for fraud. They use data analysis constantly, and they work. And then CMS works with states on corrective action plans, and they work together to root out and prevent waste, fraud, and abuse. This is different because of the way that they're withholding funds until and unless you prove that there's no fraud in the system, and that is an existential threat to the infrastructure, because what provider can continue to operate without funds until unless they prove that there's no fraud? So we're very concerned about this. We just put together new messaging, updated messaging for our state chapters to use if and when they're being targeted for in this way. And I can put that in the chat as well when I'm finished. So what else to say about this? So just be prepared. I know that there were announcements just last week or recently in Michigan about some alleged fraud. And like we said, we're happy for bad actors to be caught, but the widespread cuts to Medicaid will only hurt people. Okay, next. So what can we do in these threats? We can't give up. We can't mourn. We have to organize. We need to stick together and educate members of Congress about HCBS, home and community-based services. These home care services and caregiver. They're attacking home and community-based services and they're attacking caregivers, saying things like Medicaid is paying for things that families used to get for free, for example, which is insulting given how hard it is to take care of some individuals and what families are going through. We feel like members of Congress don't understand what it's like. We wish they could walk in our shoes. So in order to do that, we have to make sure that we're educating members of Congress what are home and community-based services? What does that look like? What does it look like in your families? You can invite members of Congress to see some of the services that you provide, or make sure you go and testify whenever there's a hearing in the state legislature, or if they're holding any kind of town halls, and make sure that your policymakers understand what home services really are, what Medicaid waiver services look like. And pushback works. In Ohio, just a couple of weeks ago, you may have heard in the news that the legislature slipped in an amendment that would completely end paid family caregivers through the Medicaid waiver. And the ARC of Ohio organized families to go and testify so that the state legislature understood what that really means. So family members brought their family members with disabilities to the legislature and provide really compelling testimony. And as a result of that testimony, they withdrew that amendment. So the ARC of Ohio was instrumental in making that happen. Next. So I'll quickly go over what's going on in education next. What we're watching are several issues. The move of IDEA out of ed, a new federal voucher program, and we're watching rules related to that. There's congressional actions that could lead to IDEA changes that I'll talk about, and then there's a bill that was reintroduced to prevent restraints and seclusion in school. Next. So first, I'm sure you're aware that on that just recently, the week of June 15th, the Office of Special Education and Rehabilitative Services was moved from the Department of Education to the Department of Health and Human Services. The OSERS contains two offices, the Office of Special Education Programs and Rehabilitative Services. And then the Office of Civil Rights within the Department of Ed was moved to the U.S. Department of Justice. So we had been very strongly advocating against this move because the Department of Education, the Office of Special Education and Rehabilitative Services is extremely important in overseeing education programs for students with disabilities. And of course, the Office of Civil Rights is where families turn if they're not getting their services or if they're being discriminated against. We're actually the ARC is actually part of a lawsuit to try to stop this and to try to stop the complete elimination of the Department of Education. IDEA by law is supposed to be overseen by the Department of Education, so we feel like this is an unlawful move. So what they're doing to overcome the law is they're using what's called interagency agreements. So they're trying to get around the law by having contracts. So we're strongly against this. We've actually had a lot of press. Katie Neese, our CEO and president, was interviewed on MS Now. And we've been quoted in the New York Times and many other media outlets. So you can just Google it. Next. So the other thing that we're watching are regulations that will come out of the Department of Treasury related to another part of the 2025 Reconciliation Law, or One Big Beautiful Bill Act, was they created a new federal voucher program. The reason that we're concerned about this federal voucher program is that we are concerned about any voucher program that could weaken public education, where most special education students have their rights met. Their free and appropriate public education. When individuals or families get a voucher and go to a private school, the private schools don't necessarily have to provide their rights to IDEA. And then it also weakens the public education system in general. So the thing to know about this federal voucher program is that states need to opt into it. And Michigan has not yet opted into it. So you still have a chance to educate your state legislature and say, we do not want to opt into this. And you can see the states that have or opted in or opted out in this slide. Next. The other thing that we're watching are congressional actions on IDEA, that's the Individuals with Disabilities Education Act, or our main special education law. Senator Cassidy from Louisiana, is the chair of the Health, Education, Labor, and Pensions Committee. And he has always been very concerned about dyslexia, and he's been pushing a bill called the 21st Century Dyslexia Act. Our concern is that this bill amends or changes IDEA, and if there's a bill that changes IDEA, then there could be a lot of amendments provided by other members of Congress. So anytime a bill is opened up in this Congress, we're really concerned because it could other members of Congress could weaken the law. So we're watching this very closely. Senator Cassidy lost. This is old. He's up for re-election this year, and he actually lost his primary. And so we know that because this is his last chance to get this bill passed, that he's going to be pushing it really hard. So stay tuned. Next. And then finally, the good thing is that the Keeping All Students Safe Act, or CASA, was reintroduced in this Congress. This is something we've been pushing for years. We don't expect it to pass this year, but we're really happy that we at least have a Republican co-lead that makes it have a little bit more of a chance. This would ban the use of seclusion and deadly restraints and greatly limit physical restraints to students in schools because students have been severely harmed and sometimes have died because of the use of these deadly restraints. So we finally have a Republican co-lead, and as I mentioned before, nothing's passed unless it's bipartisan. And even if we don't think it's going to pass in this Congress, we have to keep pushing. It's a model for state legislation, and someday maybe we can get enough bipartisan support where we can get a federal law passed. Next. Next, ways to get involved. There's lots of ways to get involved. First of all, you are really important because legislators want to hear from their constituents, not lobbyists like me. You are the experts in disability. You offer valuable information that can help policymakers make good decisions. Many legislators at the federal, state, and local level just don't know what it's like to walk in your shoes, as I said before. So it's really important that you get involved in helping to advocate at the federal, state, and local levels. This is a picture of Liz Weintraub talking to Senator Casey from Pennsylvania. Unfortunately, he lost his election in the last election, but he was a big champion, and she's a great advocate. Next. So you can't see the small print, I know, but when you get this handout, you can see who your members of Congress are, your representatives, and as you know, you have 2 senators, but you should know who your representative is in your district. And there are links here to all the members so you can find out, where their district is and, what do they care about. As the previous speaker said, it's really good to understand what they care about, what's their agenda, what committees are they on, what bills have they introduced, and are they sponsors of legislation that we care about? Are they on the Disability Caucus? And for example, in Congress, there's a Disability Caucus, an Autism Caucus, and a Down Syndrome Caucus. So one of the things that you could advocate for your representatives is to be on those caucuses. It's really simple. Doesn't take much for them to do it, but it helps to show that they care about our issues. Next. So I talked a lot about things that are happening that are bad but we also are watching legislation that that we support, and that we need to continue to get additional co-sponsors, bipartisan co-sponsors for example, the full funding for IDEA, and here are the bill numbers. We continue to push to get additional co-sponsors. This would increase over time the funding for IDEA. There are bills to reverse the cuts in Medicaid and SNAP from the One Big Beautiful Bill Act. And here are the bill numbers, and we're trying to get bipartisan support for those bills because we would really like to maybe in the next Congress reverse the cuts that were made in HR 1. And then there's also several bills that would increase support for direct support professionals, and also a really important bill called the Medicaid Access Act that would make the Medicaid waivers for home and community-based services mandatory instead of an optional service. Since most individuals want to live in their home or in their communities, we feel like it's important to make that a mandatory and not optional program. So we're monitoring all of these bills. Next. So we have a lot of resources for advocates. We have for our chapters, there are toolkits that have resources that help to advocate for all of these things. We have a whole toolkit just on Medicaid that has summaries, like I said, of the work requirements, fact sheets on Medicaid, the summary of the new work requirements, also the work requirements in plain language, and explainers of the One Big Beautiful Bill Act. These are all available to you in our toolkit, and Sherry can make sure that you have access to them. Next. We also have an action center at the arc.org/action. Here are the current action alerts that we have up. We actually have a new election center that has all kinds of resources about how to get involved in voting, which is extremely important. We can't get our priorities passed in Congress if we don't have members of Congress that care about our issues. And of course, we need your stories about Medicaid, home and community-based services. Please share your stories there, and we use these every day. Just yesterday, there was a hearing in the Energy and Commerce subcommittee, and we use the stories that you sent us to send to members of Congress on that committee so that they understand how important home and community-based services are. The hearing yesterday was about the issue of waste, fraud, and abuse in the Medicaid system. And like I said, home care is being targeted, so we need folks to understand how important that is. We have one on education because of the move of IDEA out of the Department of Ed, and then one on SNAP on food assistance. Okay, next. I see a question about Social Security. Yes, the solvency has been in the news again. Is there discussion about changes to SSI and SSDI? Yes, there are bills to reform Social Security to strengthen it, and also to make it easier for people with disabilities to make money and not lose their Social Security. I'm sorry I didn't go through some of those bills, but there are bills related to that, and we're hoping that in the next Congress we can get those bills passed. The solvency has always been an issue, and there are ways to shore up the Social Security system without losing, our programs and Social Security support. Social Security is also under attack in terms of the Social Security Administration. Doge cut a lot of the staff, making it more difficult for people to be able to connect to the Social Security offices in their states. We also are working, we continue to push very hard against those type of changes. Darcy Milburn in our office works on Social Security issues. She has been into meetings with SSA and on the Hill, pushing the bills that would make it easier for people with disabilities to make money without losing their Social Security. So I don't think this will affect Social Security survivor benefits yet. It is not insolvent. I don't think you need to be concerned yet. We need to have, but we do need our members of Congress to care about it, and there are many ways where Social Security can be shored up without hurting beneficiaries. Okay, so as I mentioned, we have a voter toolkit. There you have the power. It's like, as I mentioned before, people with disabilities are a large voting bloc, but only if they vote. And Jenny Alexander is leading this effort. You can email her through the email on this slide, and their monthly chapter meetings just related to voting. And you can go to the website to see all the resources that we have. Next. These are just all the ways that you can get connected with the ARC of the United States and sign up to get the action alerts. Our action alerts make it really easy for you to take action because there's just a stated issue, and then we have sample letters, so you don't even have to know who your member of Congress is. You just put your zip code in, and you'll get an editable sample letter, and so you don't have to do a lot of work. Next. And then hold the date. Every year we have a disability policy seminar. Next year it's March 15th to 16th, and it's in Washington, D.C. It's really fun. It's a day and a half of training, followed by visiting your members of Congress on the Hill together with other folks from your state. We usually have a rally on the Hill where members of Congress come and talk about disability issues. It's spring, so it's a pretty time to be in Washington, D.C. So I hope you'll consider coming. If you go to disabilitypolicyseminar.org, you can get more information about how to register and what issues will be following. Next. And that's it. I'll take any questions. Let me look in the chat to see what's in here. PowerPoint's available.
Yeah, I think you caught all the questions as they were coming in, Kim, and incorporated them. You shared links for people to access this PowerPoint presentation, and then later the recording of this presentation is available on the ARC Michigan link. The recording will be at the same place where the handouts are currently available. So if folks want to access these resources that you shared, go there. I also shared in the chat the link to the ARC Michigan newsletter, which is those notifications of actions that you can take about current legislation. All All right, I'll give the chat just another moment to see if anybody has anything else that they would like to add. I see Kim posted another link in the chat.
Well, I think that's it. I appreciate you coming, Kim, and talking with us about all the issues at the federal level. They're really important. I want to thank everybody who's online for attending this year's summit webinar series. And we will be back here next year in June to do more updates in the last year. So we will see you then. Thank you, everybody.
Thank you, everybody. Thanks for having me. Have a good weekend.